Hello, welcome to this edition of Research Connection. Joining me today is Dr. Joanne Intile and Dr. Alexandra Gareau. Hello.
Hi, how are you?
Hey.
Hi. So let's start with a little bit about you two. Alexandra, go ahead.
Sure. Hey, everyone. My name is Alexandra. I'm the first year medical oncology resident at the NCSU College of Veterinary Medicine. I did my vet school at Montreal University in Quebec, Canada, and then did a rotating internship at Purdue University in Indiana. And that was followed by a apheresis and bone marrow transplant fellowship here at NCSU. And I was happy to learn that I was staying as a resident.
And I'm Joanne Intile. I'm one of the medical oncology faculty here at NC State. I've been here a little over 4 years. My background before coming to NC State was I had worked in private practice referral hospitals in upstate New York, in Maryland, and also on Long Island. And then after working in referral for several years, decided to come to academia, and I've really enjoyed my time here working with health officers and students and the other faculty.
Fantastic. And Dr. Gareau, you recently received an award from the Veterinary Cancer Society. Tell us a little bit about it.
Sure. So I guess I'll start with a little bit of just stating our goal and a little bit of background. It's a prospective study. So we are going to, our research is going to be in client-owned dogs, in which the primary goal of our study is looking at so whether elevations of SDMA, and I'll go on into explaining a little bit more what SDMA is, but so to determine whether elevations in SDMA values will predict bone marrow suppression in dogs with cancer that are treated with carboplatin chemotherapy. And a little bit of background for this goal. So carboplatin is actually a drug that we use very commonly in our medical oncology service. And we use this drug to treat a variety of different cancers. And what is important to know about this drug is that it's excreted via the kidneys. And like many other drugs, carboplatin can cause, bone marrow suppression and GI toxicity. And so because carboplatin is excreted through the kidneys, patients with reduced kidney function can have a prolonged excretion of carboplatin. And when that happens, well, both the tumor and healthy tissues can be exposed to prolonged periods of time to this drug. And so there's actually literature supporting that decreased kidney function in cats and humans can lead to bone marrow toxicity, but there's no such studies that are reported in the literature, at least in the canine literature. And so, we don't have that supporting literature, but we know that dogs can have carboplatin associated toxicity, those with decreased renal function. And so for this project, our goal is to look at SDMA. So SDMA is a validated renal biomarker in veterinary medicine. In other words, SDMA represents a sensitive indicator of kidney function in cats and dogs. And so by using SDMA, we're hoping to predict toxicity in dogs that are treated with carboplatin. And so, this will allow us to predict more accurately patients that are at risk of myelotoxicity, the ones that we are worried that they may have reduced kidney function, and eventually that could help us individualize dose prescriptions.
And then again, the funding from the VCS support is going to help tremendously because we will be able to pay for chemotherapy treatments for the dogs that are being enrolled, which is going to be helpful, I think.
And you have a couple of collaborations on this as well. Right?
Yeah, so we have Dr. Shelley Vaden, who is an expert in renal physiology. So we have her as a consultant for the project. And then Dr. Papich, who is an expert in pharmacology, who will help us with some of the data that we will be looking at specifically when it comes to how these dogs clear the chemotherapy drug from their blood.
Thank you for sharing, and best of luck.
Well, thank you.
Thank you. Thanks so much.